The rectus abdominis muscle, also known as the abdominals or abs, is a paired muscle running vertically on each side of the anterior wall of the human abdomen. There are two parallel muscles separated by a midline band of connective tissue called the linea alba. It extends from the pubis below to the tip of the sternum and the cartilages of the 5th to 7th ribs above. The rectus abdominis is an important postural muscle. It is responsible for flexing the lumbar spine and when doing a so-called crunch or sit-up. The rectus abdominis assists with breathing and playing an important role in respiration when forcefully exhaling, as seen after exercise. It also helps in keeping the internal organs intact and creating intra-abdominal pressure, such as when exercising, lifting heavy weights, or during forceful defecation or childbirth. It has three main trigger points. The third trigger point is present near the lower attachment of the rectus abdominis. Apart from the lower back pain, these trigger points can manifest as digestive symptoms like diarrhea, constipation, etc. But since all of these areas could also be indicative of a deeper problem, please go to a doctor to rule out anything else before continuing with self-release. Remember the location of your point as we move to the self-release video.
There are a lot of organs present in the abdominal cavity, which also present pain over the abdomen. So in case you're not sure that the pain is purely muscular, please go to a doctor or a qualified professional for a consultation instead of opting for self-release. Now for the self-release instructions. There are many ways to massage the rectus abdominis. Lie down on your back and locate the trigger point. It is present near the upper abdominal area, just under your ribs. About 1 finger width lateral and about 2 to 3 finger widths above the navel. Gently palpate for painful spots over your abdomen. Once you've localized it, apply pressure on the spot, gently using the fingers of your hand. Please make sure you do not put too much pressure unless you are well versed in anatomy and bodywork. The other way of massage is to lie down on your abdomen and place a ball over the painful area and hold. You can use a larger ball for increased pressure. Hold in position for about 30 seconds and release. Another way is to use a yoga block and a ball over the block such that the ball is present beneath the trigger point. Lie down over the ball in this position. Hold for 30 seconds and release.
To stretch the rectus abdominis, lie down face first over the ground. Place your palms on the ground. Slowly raise your torso up using your hands. Stretch your torso as much as you can by making sure the chin faces up. Hold for 30 seconds and release.